Good morning, everyone, and welcome to Pathways.org's presentation, The Whys and Hows of Tummy Time. Thank you for taking time out of your busy day to log in and learn tips to help the baby or babies in your life. Today, Dr. Zachry and I will be discussing why tummy time is so important. We'll give you practical ideas of how to incorporate tummy time into your baby's daily routine, and we'll introduce you to some great resources, including Dr. Zachry's book and our Pathways.org website. So let's get started. First, I want to tell you a little bit about Pathways.org. We are a national, nonprofit educational foundation established in 1985. Pathways.org is dedicated to empowering parents, health, and early childhood professionals with knowledge about the benefits of early detection and early therapy for children's motor, sensory, and communication development. We are led by a medical roundtable consisting of leading physicians, clinicians, and lay advisors who provide strategic direction to our organization. And we've developed many resources on our website, videos, handouts, which are all free to download and copy, and you'll also find us active on Facebook and Twitter. Today, we're very excited to be collaborating with an expert in this field, Dr. Zachry, who is an assistant professor of occupational therapy at the University of Tennessee Health Science Center. Dr. Zachry is the author of Retro Baby, which has been published by the American Academy of Pediatrics and recently won the Gold Award from the Independent Book Publishers. This book is just chock full of information, tips, and play activities for children from birth to 24 months, and it's organized in an easily readable format for busy parents. And now, on to the main topic of the day. What is tummy time?
Where did this term tummy time originate? Well, it dates back to 1992 when the American Academy of Pediatrics first recommended that infants be placed on their back to sleep as opposed to the traditional infant sleeping on their stomachs. And it was wonderful in that it resulted in a 50% reduction of sudden infant death syndrome. About the same time, there was also just an explosion of baby gear products that hit the market. Everything from portable car seats that you could clip right into shopping carts and strollers, swings, bounce seats, lots and lots of positioning options for parents. But the end result was that babies were no longer getting that 12 to 15 hours of tummy time each day that they had gotten previously. And many parents were reluctant to position their babies on their tummies even when they were awake. So what started off as a safety recommendation did have some unintended consequences for babies' development, and most significantly an increase in early motor delays. So the original Back to Sleep campaign modified their message to back to sleep and tummy to play, and thus tummy time term became more popular. And that really means supervised time the babies spend on their stomachs while awake. And as you can see from all of our little friends here, it can be a very happy time down on their tummies. Why is tummy time so important? Well, in addition to really helping the baby develop head control, tummy time is also critical for building muscle strength in the back, neck, shoulders, and core of the baby. And the strength is all really important for their foundational motor development, including their posture control, their balance, and their gross and fine motor skill development. In addition, you can imagine all of the information from a sensory perspective that the baby is getting through the skin on their forearms and on their belly and on their legs when they are down on their tummy, especially if they start to move and get that additional feedback. And so they're learning a lot about increasing their awareness of their body position and thinking about the world around them a little bit more. It also, tummy time, helps with visual skill development, both in terms of them increasing their head control, their ability to scan with their eyes and focus, use their eyes together, and to shift between their near and far vision. Hopefully, parents are able to be down on the floor with their baby, and so this gives an opportunity to continue to build a bond between the baby and parent and really start working on those early socialization skills. And finally, that also helps to prevent conditions like plagiocephaly and torticollis. And I'm going to spend the next couple of slides just describing these conditions since you're likely to read about them in the media as well. Positional plagiocephaly is a big medical term which basically means flat head. And that's because infant skulls are somewhat soft, and so a baby constantly laying on their back can cause a flattening of the back of the head or possibly a side if they have preference, which is known as plagiocephaly. In addition to being caused by lying on their backs, it can be associated with limited tummy time, overusing the baby gear that we talked about. Premature infants, a little bit more at risk because they have softer skulls and weaker neck muscles. And what we do know is that the incidence has increased dramatically. Prior to the Back to Sleep campaign, only about 0.3% of babies were diagnosed with plagiocephaly. But in a recent Canadian study, about 46% now are given that diagnosis. So when we think about it, that's almost every other child at risk. Pretty significant. But the good news is that it's pretty easily preventable and correctable by the parent doing more tummy time with the baby and just thinking about repositioning and giving them lots of options in how they spend their day and the contact that's made with the back of their head. And so in most cases, that's enough to do. If it's untreated, plagiocephaly can lead to permanent deformation of the skull and possibly even facial asymmetry. So it is important to be aware of it. And I'm sure some of you have seen babies wearing helmets out in the community. Definitely part of this trend in addressing plagiocephaly. The helmets are meant to gently mold the growing skull into a more typical shape. But again, in most cases, daily tummy time can really help avoid the development of plagiocephaly as well as enhancing the baby's motor development. And now positional torticollis, another term. It is where one of the muscles in the neck is shortened or constricted, causing the head of the baby to predominantly tilt and possibly turn to one side. And it often does result from being crowded in the uterus, more common in larger birth weight infants, twins, but it can be aggravated if infants spend way too much time on their backs or in containers. And again, tummy time, repositioning, and limiting time in containers usually does the trick in helping to correct any risk of torticollis. And now we want to talk about how to do tummy time. A 2010 study told us that 90% of new parents receive information about positioning their baby for sleep, but only about 55% receive information about positioning their baby while awake. They're told to do tummy time. They know the term, but not really the hows. And we all know that it's really easy to give up when the baby cries and protests when you do try tummy time, maybe for the first few times. So what we would like you to do now is just relax and watch a video that we've produced, 5 essential tummy time moves, which will hopefully give you some new ideas just about figuring out ways to incorporate tummy time into just the natural part of your baby's day.
Pathways, trusted to assure the best for all babies' physical development, presents 5 essential tummy time moves. Tummy time is one of the best and easiest ways to enjoy some time with your newborn. But tummy time is also essential to your baby's optimal physical development. Babies who skip this important step oftentimes experience delays in crawling, walking, and possibly even eating and talking. That's why Pathways suggests you incorporate these 5 essential moves into your baby's daily routine. Remember, begin tummy time soon after your baby is born. Start with a few minutes, working up to an hour per day in spurts by 3 months of age. Link tummy time with familiar activities such as diapering, bathing, or even playing. Tummy time should be fun time. Position 1. Tummy to tummy. When your baby is happy, fed, and awake, it's the ideal time to try some tummy time. Here, Mom leans back, propped up by a pillow to keep baby angled up slightly. She then positions his tummy against hers. It's important to use your hands to keep baby stable. Even if your newborn isn't lifting his head yet, this position will help him get used to tummy time and help him build and strengthen back and neck muscles. By 3 months, he should definitely be lifting his head and pushing up on his forearms to try to look around. Position 2. Eye level smile. Babies love your face and voice. Here, baby is trying hard to lift his head and look at mom. Get down on the same level as your baby. Voices and faces are great motivators. Position yourself in front of your baby to encourage head lifting, and then move your face or a toy side to side to encourage head turning. If your baby consistently prefers one side, take note and bring this up with your pediatrician or healthcare professional. Position 3. Lap soothe. Here, baby is learning about tummy time with mom. Mom places him across her lap. She can have both knees even, straighten one leg, or raise one leg higher, like mom is doing here, to keep the knee under baby's chest higher. A hand on baby's bottom helps to stabilize and soothe him. Position 4. Tummy down carry. The tummy down carry is a good alternative to always carrying your baby upright on your shoulder. Mom is supporting baby with one hand between the legs and under the tummy, and the other hand supporting baby's head and shoulders. Here, you can see how mom nestles baby close to her body for additional support. This is a great position for dads to do too. Think about using this when you're carrying the baby from room to room. Every bit of tummy time makes a difference. Position 5. Tummy minute. Start to incorporate tummy time into your daily routine. For example, every time you change your baby, place him on his tummy for a minute or two. Here, mom positions a rolled-up receiving blanket under baby's chest and upper arms so that his chest is propped up. Babies love consistency, and linking diapering and tummy time will definitely remind you to do it, but your baby will also see this as a natural part of diapering. Here, mom is using a mirror to keep baby interested. Babies love faces. So remember, it's important for even newborns to get some freedom of movement on their tummies. Moms, dads, grandparents, and caregivers can start to incorporate these 5 essential moves into baby's daily routine right away. Begin with just a few minutes a day, a few times a day from birth, and work up to an hour a day in spurts by the time the baby is 3 months old.
Great. And now I'm going to bring Dr. Ann Zachry onto the line, and the two of us will be happy to answer any questions that you may have. Hi, Ann.
Hello.
I think we have one question so far asking a little bit about the research that correlates a link between back to sleep and the need for tummy time.
Yes, and thank you guys for having me. First off, I wanted to say that. I'm glad to be here. There is some research that I quoted in my book, Retro Baby. The primary study is by Hutchison, and it was the Pediatrics Journal, which is the Journal of the American Academy of Pediatrics. It was in 2001 that did correlate the use of equipment and limited tummy time with the plagiocephaly and the torticollis. So there are actually quite a few references in the book that any reader can find the specific references if they're interested.
Great, and we now have a question about how do we sort of model tummy time for premature babies when they're just tiny, just weighing 3 or 4 pounds? Do you have some suggestions?
I think with the premature babies that it is great to use some of these alternative positions that you showed on the video. For example, the tummy down hold, because that way they still have that contact with mom or dad or the caregiver, and they're getting the exposure that they need to use those trunk and neck muscles. And having them, when you lay in a laid back position, having the baby positioned on your chest as well, they can see your face, it's right there, but the baby is not feeling all alone, and sometimes they can kind of get startled if they're laying flat on a surface and don't have something around them, so you can hold them in your arms and they can still get the benefits of tummy time.
I think that's a real key point, you know, that the babies really crave that connection to the parent, and that also allows you to add a movement component by gently swaying them and patting them, and so often that ability to sort of sneak in some tummy time and then eventually move down towards the floor is the best way to go in introducing it. And we've had great success in sort of, you know, modeling and opening up people's ideas about what tummy time is defined as and constitutes.
Exactly.
We have one question about should we do tummy time with or without clothing?
I think it can be done both ways. If the room is warm enough and it's comfortable for baby, especially right after a bath, baby can be without any clothes and be on their stomach, and they get that sensory experience of if you place them on the towel or whatever surface they're on, as long as it's not cold and hard, you don't want that. But they do enjoy getting those sensory experiences, and it's great for their system, their sense of touch. And if you lay them and they're naked and you just lay them across your chest or lay them across your lap, that's also that skin-to-skin contact, which is so important.
No, I agree, and I guess the big message that we're trying to get across is you just want to do it in little bursts throughout the day, and so you want it to be as simple and natural as possible. So you seize the opportunity if they have clothes on or clothes off. Another way that you can do it is after each diaper change, having, you know, the baby just then rolled onto their tummy for a little while after you've changed the diaper, and maybe it also is a time when you could be doing fasteners up, either lying on the side or on their tummy. And soon, I think we often hear that the baby almost anticipates that as part of their routine as well.
Exactly. I think those are great suggestions. After a diaper change, when you're changing their clothing, you can move them into that tummy time position and side lying, and it just gives them different experiences, and they have to use different muscles, and it's great for baby.
Looking for even more suggestions beyond the 5 essential moves. Anything else pop into your mind right off the bat, Anne?
Beyond the 5 essential moves?
Right.
Well, just that they don't have to be just static moves, but carrying your baby in these positions because of the movement that they experience is so great. So if you do have them in that tummy down, to walk around, and the baby visually, it's so stimulating for them to see everything around them. So I think that's important to keep in mind, that it doesn't have to be right on the floor, and if you're holding your baby, you don't have to be sitting still. You can be moving or rocking in a rocking chair, rocking side to side. I just think those are great ways to incorporate the different positions and make them more interesting for babies.
Yeah, I think that's just great, and really thinking about playtime too, when you are just, you know, naturally going to be introducing your child to some of the fun little toys that they'll be interested in. And this age group, usually it's things like, rattles, some noisy toys, some even simple things like beads, pulling out the measuring cups, anything that you can just have some fun with your baby. And most of the time, if you're there too, you'll probably be able to up the time that you are able to get them into a position. Another thing I know that works often in the clinic is sort of pulling in siblings to be part of the action too, and getting them to make funny faces and chat with the baby, and just those natural little entertainers that they can be can allow you to sneak a bit more time in as well.
I have had great success with siblings. I think that is absolutely true. And the smiles and the interaction that they get, it's just a motivator for the baby to stay in that position. Exactly.
One question is, how long is too long for tummy time?
In my opinion, when the baby starts to resist, I do not force them to stay in that position beyond that time. So if they've been down there for 10 minutes and you're playing with them or whatever, but they start to resist, or even a shorter period of time, give them a break, and just like you said earlier, just incorporate it in small bits of time until the baby enjoys it and wants to be on their stomach. Because once their muscles in their neck and trunk and shoulder girdle are strong enough that they can hold their head up and push up and look around, they'll want to be in that position more typically than when they have that weakness. So a little bit here and there is better than trying to force longer periods of time, especially if the baby's resistant.
I think that's exactly what we do. And even at the beginning, if it's 30 or 45 seconds, and then a little break, and then gradually increasing that, every little bit counts as tummy time and starts to help the baby accommodate to that different sensation of being in a different position. I know that we often get questions about what other techniques can you use when the child really does not like being on their tummy. And in most cases, the first few times when you introduce it, you're likely to get that kind of a reaction. Any tips?
Well, my guess standard answer for that is the chest-to-chest tummy time, because that has you and your baby face-to-face, and that interaction is such a motivator. And like you said, I mean, it can be a goal of 15 seconds at first. So if you have to incorporate lay back on the bed, place baby on your chest, sing, be as animated as you possibly can to get your baby's attention and just distract them so that they don't really realize that they're on their stomach. And then as soon as they start to resist, or if they're not trying to hold their head up, then give them a break and come back later. And you want to catch them when they're in their happy moods. So you definitely don't want to do it at a time of the day when baby's typically fussy, but we look for those times when they're happy and cheerful, and hopefully you can ride in on that and get some tummy time in that doesn't go too badly.
I think that picking the optimal time is definitely a better chance for success too. So if you're thinking about a well-rested baby, probably not immediately after a meal, and just as you said, when they're in that kind of playful, engaging kind of mood, to take advantage of it and seize the opportunity. I know that we have a question here about what about when a baby does have a lot of reflux and really hates tummy time. Any suggestions for that case?
Well, I always refer back to the pediatrician with what are the recommendations when there's a reflux issue, but I do know that you can put a baby in tummy time on a reclined surface so that they're at an angle, and sometimes you can find in wedges, things like that, and put baby, and you can use your body or your leg, but so that they're on a slight incline to help with the preventing the reflux, but they're still down on their stomach and they're still having to use those muscles in their neck and their shoulder girdle.
Yeah, I think the incline is definitely, something that you look around your home and see whether there's something that you could use. What about a boppy pillow? How do you feel about that, Anne?
I am okay with the boppy pillows. I actually just prefer to roll up like a receiving blanket because I think it's easier to mold that to the baby's position and shape, where the boppy pillows tend to be a little bit more firm, and you can't get them in the position to kind of mold around the baby. But I think that, used as long as you can get your baby in the right position where their nose is not going to be face down when they put their head down. You want to make sure their shoulders are above and around and their hands are almost touching the floor or touching the floor when they're on that boppy pillow. So sometimes I've seen them used inappropriately where the baby's pushed too far back, and when they lay their head down, their nose is right in the fabric of the boppy pillow.
Right. And I guess with reflux, too, just definitely using that tummy to tummy with yourself so that you could really control the angle that might be optional. Of course, there's always make sure you've got a little burping pad underneath because that you're in the direct line of fire, but hopefully you can make it a pleasant experience for the baby as well.
And I do tell parents if the baby has reflux and they have a recliner, that is a great way to try different angles. So you can start higher up and gradually lean back in the recliner and see what can your baby tolerate.
Right. One parent is saying that the doctor is talking about their baby having a larger head, and so that makes it obviously harder for the baby to keep upright. Wondering sort of how long that will be a factor and any, customization that we can suggest related to a bigger head.
My oldest child weighed 10 pounds and 3 ounces, and his head was very large for his little body, so I can relate to that. And I did have to really introduce tummy time gradually with him, and it just took longer for him to get the muscle strength to hold his head up than it did if his head had been smaller. So, and I think it's fine to help give them a little support. You can, touch underneath their chin and to kind of encourage them to hold it up for several seconds, but also just using really motivating toys, colorful rattles. My book Retro Baby has a lot of handmade toys that are made from things that you have around the house that you don't have to be a crafty person to make, but they're fun for the baby and motivating. Music and noise, anything, singing to the baby, anything to just give him that motivation to hold the head up for a little while longer, and then with time, those muscles will get strong enough to where that he can tolerate tummy time.
Great suggestions, Anne. Another very specific case where a child is born with an omphalocele. I know sometimes, too, there's G-tubes to consider or other issues in the abdominal area. Do you have any experience with specific suggestions related to that?
I really have not worked with infants with special issues like that as far as tummy time goes. I typically refer back to the pediatrician and find out exactly what are the guidelines, what does the pediatrician say is possible and is recommended and what is not recommended. And so in specific cases like that, I usually prefer to speak to the physician first.
I think that's always good to just rule out any special precautions that need to be taken. I know sometimes if it's something like a G-tube, we've been able to just use a little receiving blanket and create a little bit of a circle to kind of go around that area and just boost the baby so they don't have direct contact and friction or something where you leave a little gap in that area that you might be of concern, but have more of the pressure on the baby's chest and leg area.
Right.
Certainly using just your own, if you use that lap soothe pattern, you could, again, have your legs slightly separated and have that being the natural gap for an area that you might be concerned that would be too much pressure on a particular aspect of the baby.
And exactly, I have seen babies that have had like a firm type mattress and had a cutout area for, it was more of a tummy time activity mat, but there was a cutout area for a G-tube, or a tube, stomach tube, excuse me, and that seemed to help because, like you said, it didn't put the pressure and the friction on that area.
Interesting question here about just theory that some expound that you should wait until a baby has developed the muscle strength to hold their head up before beginning tummy time, and others are saying right from the hospital. So what do we think about that?
I think that I don't agree with that now in these days because naturally, in the past, babies slept on their stomachs. That was before we knew that it put them at risk for sudden infant death syndrome. So they had natural opportunities to hold their head upright, and when they would wake up in the bed, they would look around and they'd be watching for mom or dad. But now, babies just don't get those natural opportunities, and what happens is if you don't start tummy time from the first days of life, your baby will sleep on their back, and when they wake up, they're just laying on their back. They really can't lift their head and use those muscles in their arms and shoulders to try to push up until they're able to roll over. So it's likely that they're going to start resisting tummy time, and that's not a pattern that you want to get into because it can be hard to break if your baby does not like to be on their tummy, and you may have to try some of these extra special techniques to try to get them to tolerate it. So I think maybe back in the days when babies were sleeping on their stomachs, that might have worked, but now that we know back to sleep, tummy to play, we definitely need to start tummy time early.
I agree totally. And if you think about the position that you're offered your baby in the hospital, tummy to tummy right in the delivery room, we know that they, can be comfortable in that position and they have the reflex to turn their head and keep them safe. So you can really think about introducing it very early in a safe way. Definitely they seem like tiny little packages on the floor, that early on, but I would definitely use some of these other strategies to incorporate it into caring positions and in a way that the baby will feel soothed and happy. And you really do use that window of opportunity to start introducing it early so that it will just be a natural part of their routine and much, much easier than trying to introduce it later when they're already getting a little set in their ways.
Exactly.
I think I don't see any other questions, but certainly
well, I see one here. There was a question about what are the advantages of giving tummy time, and I know we've talked about the immediate advantages, but I thought I would speak to long-term advantages just from a perspective of an occupational therapist, that what happened, the reason I even became interested in this subject initially was because in the late 90s I was working with children, preschools, age 3 to 5, and I noticed that there was just a sharp increase in referrals for babies that had upper extremity, or I guess young children who had upper extremity weakness. They had difficulties when they were preschool trying to hold writing utensils, and they had posture and just weakness. And so I sent home questionnaires to the parents and found out that most of these children were not tolerating tummy time as babies, and so they didn't get that exposure. So the muscle weakness that they had carried over into childhood. Now, fortunately, there are plenty of things that we can do and activities and exercises, but the benefits long term are that it helps with your core and it gives you a good solid base of support for when you're a child and it's time to start all those preschool fine motor activities that are so fun for the children.
I agree, and definitely over my 30-year career as a physical therapist, I've definitely seen difference in terms of acquisition of motor milestones, babies being a little later rolling, a little later crawling, a little later, walking, and certainly this is an easy way of just getting them to really work on strengthening all the muscles they're going to need in the future for that, and a balance between the muscles on their front of their bodies and the back of their bodies. We did have a question, too, about whether we're recommending that caregivers do these tummy time moves with infants in child care settings as well.
Absolutely. I think I had the opportunity to observe in 6 different child care centers for some research that I carried out, and I unfortunately saw so much equipment use. It was it was like rotisserizing. They would move the babies from one piece of equipment to the next, and there was not as much tummy time or any of those tummy time moves. So I think it's fine to ask that the daycare providers carry that out and just make sure that the baby is comfortable and not fussing and not resisting, but I think it's something important to be carried out. And also the suggestion of doing it when they change the diaper. It doesn't have to be a long tummy time session, but just maybe a couple of short ones throughout the day.
Right, and we know that our daycare providers want to, do the best for your children as well, and so just like you're giving them instructions about, the things that are important for your baby and the things that they respond to and like, you can give them an idea of the best ways that your baby responds to that, or the positions that they like to be held in, and that's an easy way to for the daycare provider when they are holding the baby to maybe just incorporate, a football hold or another position that the baby might respond to, or when they're soothing them to try to lap soothe some of those aspects under your direction and what works best for your baby.
I think that's a very good point, and to say that the resources on Pathways, there's flyers and handouts, and so if the baby, a lot of times in the daycare settings, they will try the traditional tummy time on the floor, and if your baby's resistant, they might think, oh, he doesn't like it, we don't want to, him to be fussy. But if you can get some of those resources from the website, which I'm sure you guys will share, they could share those with the caregivers in the settings and say, here are some options, and he really likes this position, and this one works really well.
Any thoughts about firmer surface versus softer surface for tummy time?
The American Academy of Pediatrics recommends a firm surface for tummy time.
I agree. That is generally, I think they have a little more success too if they're not having to push quite so hard to get themselves up, anti-gravity. I think any connection with speech delays. Anne, have you?
I have not read any research on that.
I
don't know if that was a recent study that I missed, but I know just the motor milestones we've seen there's a couple of studies that have shown a slight delay, but then the babies typically catch up around age 1. But as far as speech, that's new to me.
Yeah, I'm not familiar with a definite research finding. I know in speaking with our speech-language pathologists, they talk about the benefits of tummy time in stretching the muscles of the neck and the jaw, and possibly helping with strengthening in the orofacial muscles too, but not sure about evidence to support that or not.
Right. I also see a question about the torticollis, and there are, my book, Retro Baby, has a lot of suggestions for different ways to position your baby. And, for example, the car seat, if you have a toy or something on one side, that's hanging down, always try to position that on the side that the baby's neck is not tight, so he can turn away and give it a stretch. Different positions around the table and feeding your baby on one side, alternating sides. So there's a lot of practical tips in there. And then typically, you know, the physical therapist or OT usually will give a program to work on stretching.
Exactly. Well, unfortunately, I think we're down to our final couple of minutes here, and there is still a flurry of questions coming in. I would invite any of you who have not had your questions answered to email us at friends@pathways.org, and we'll be happy to answer those specifically for you. But now, just in summary, I think we want to just really, again, empower you to think about how important tummy time is for building all that muscle strength and for the developmental milestones, that it's probably the most important for that first 6 months of life, and that the baby will learn to enjoy tummy time if you continue to expose them. Really think about how to entice your baby with their favorite toys or their favorite people and animated voices, and just really look for together time. And if you're feeling that pressure, remember, enlist siblings or your spouse, so it's not all, you know, on you. But every bit of tummy time makes a difference. And just like a workout, you're helping your baby build endurance as they continue to practice that. And I want to remind you that we have all sorts of free parenting resources on our website, pathways.org. It includes checklists and videos. We have a personalized monthly milestone calendar where you can enter your baby's date of birth and then get all sorts of exciting weekly activity suggestions that you will be a starting point for you. And that goes up from birth to 24 months. All of our materials are designed to help you check in your baby's development, just a reference point, recognize possible delays, and then really get you to be empowered to discuss any concerns or observations that you do have with your health professional so that you can seek a timely referral for therapy if it's necessary, because it really does help. But I want to, in addition to our website, just to remind you about Dr. Zachry's book. It is on sale at Amazon, and I would highly recommend it to parents for more tips and strategies. You've been so great today with your questions and your ideas. Hopefully you've gotten some tips from us. Thank you so much for attending our webinar, and please stay tuned for more webinars from pathways.org. Thank you, everyone.
Thank you for having me.